And here is your question. Right, so if you have read and understood, considering the history-taking station, can we begin?
Hello, I'm Dr. Muhammad, one of the exam surgical candidates. Today I have been asked to ask you some questions related to your condition. Are you okay with that?
Okay, doctor.
Thank you. May I confirm your name and age, please?
I'm Tom, 56-year-old.
Nice to meet you, Tom. May I ask for chaperone here?
Yes.
It's okay, doctor. Yes.
Okay.
Good.
So what's brought you here today?
Doctor, how do I explain to you now? I have this, loss of the sexual drive.
Having loss of his nature.
Okay. Is there any difficulty? Okay.
Yes.
Is there any difficulty with the erection?
Sometimes, yes.
When did you first notice that?
Since a month, I think now.
Okay. Does it start suddenly or gradually?
It started initially. It started suddenly. Then yes, it is like now constant.
The increase or stop?
No, not really. I didn't notice that.
Okay. Is this erection difficulty is suitable for penetration?
Yes, sometimes.
Okay. Does your partner have it is safe until your partner have orgasm?
Yes, doctor.
Is it maintained until your partner have orgasm?
Orgasm. Does it remains until your better half, your partner attains orgasm? I think this is what he's trying to ask.
Oh, no, doctor.
I'm really so sorry for that. Okay.
That's an issue, doctor.
I'm sorry for that. Do you have sexual satisfaction, both of you?
No, doctor.
Is there any ejaculation happen?
Premature.
After this problem started, I'm having difficulty because because of the problem.
Okay. Is there any problem with penile curvature?
Yes, doctor.
Is there any problem with penile curvature? No.
I didn't get
Hello?
it, doctor. I didn't.
Is there any pain associated with?
No pain, doctor.
Okay. Do you have any kind of social stress or family stress or stress related to work?
Yeah, doctor, I have, and I usually stay very busy, and then my work, it keeps me busy, and then I have lots of stress.
I'm sorry for that. Did you feel ever feeling down recently?
Oh, no, not really.
Do you have any difficulty go to sleep?
Oh, no.
Okay. Do you feel overly tired?
Sometimes I feel, doctor, when I'm really stressed out, then I feel like I'm so tired.
Is there any change in your appetite?
No, I didn't notice that.
Any change in your libido?
Oh, no, there is that drive. The drive is there, but like it's difficult.
Okay. Do you have any other chronic conditions?
What chronic condition, doctor?
Like you have diabetes, hypertension, or asthmatic? Any thyroid?
No, I don't have. I don't.
Are you taking long-term medication?
No.
Are you allergic to any drug?
No, doctor.
Okay.
Yes, doctor. Please go on.
What is your occupation?
I'm an entrepreneur. I have my wife.
Okay. Do you drink alcohol or smoke?
I used to smoke, but I quit since 2 months now.
Okay, can you
Okay.
present your history now?
So
So if
33
yes,
years old male
yes,
have presented with difficulty of erection, have no past medical history, no diabetic, no hypertensive, but he has history of smoking, and he has some kind of social stress related to work.
yes. So what are your differential diagnosis for him? What are your differential diagnosis?
It can be due to PPH.
Okay. Any other condition you consider?
Can be due to benign prostatic hyperplasia.
Okay.
It can be due to some infertility disorders.
How would you confirm your diagnosis?
I will examine the patient, then I will order some investigation like routine investigation, CBC, urine electrolyte,
Yes.
and also serum prolactin and serum free testosterone and luteinizing hormone, and also follicle stimulating hormone, and also transrectal ultrasound for PPH.
Yes.
Also, I would like to ask for
Right.
adrenocorticotropic hormone test.
Yes. Right. Okay. Bell is gone, but then yes. Can Dr. Kamal, can you give the feedback first?
Yes, you did try to like cover the questions like that needs to be asked. but maybe I was not trying to lead you. I didn't give you like the answers you wanted, so maybe I confused you a bit. But you did try to cover all the questions, especially regarding to the condition. But first initial question that you had to ask. You also covered the psychological history, and on the sexual history, you could have asked about when was your last sexual contact, use of contraceptive and all, you know,
Okay.
and stress and all, but any anxiety related to performance. And you asked about the medical, surgical, drug history, family and personal history also. Maybe when you are summarizing, you could mention about the eyes and the systemic history. Maybe
Yes.
you missed that.
Yes.
And I think that is okay. I didn't try to lead you. That's why you had some difficulty.
But that's okay, because
No,
patient
it's
can
okay.
be, yeah.
Should
this is
I
a
mention
really-
the systemic review when I summarize?
Yes, eyes as well, when you were presenting. This is very
Maybe.
important. You always forget. Everyone forgets. And then when you were
Okay.
asking the condition about the ED, then you could have asked him to rate it, because when you were asking to rate between 1 to 10 or in the scale of, yes, how bad it is. So you could have an idea. And the remaining questions, Dr. Karnas told you.
Okay.
Yes, and then, yeah. Right, because patient did say patient is an entrepreneur and patient has very much stress, work-related stress. So maybe you could have thought for psychological importance as well in BPH as well, because for BPH you didn't rule out any symptoms in particular. Yes.
What is the main differential diagnosis for this condition should be?
For the most important one is psychological.
Psychological. Okay.
Yes. And then all the rest comes later, but then I have not made this patient hypertensive or diabetic. So if patient was hypertensive or diabetic, then those can also be one of the differential diagnoses. Like here, okay, patient is ex-smoker. So there is one syndrome that you have to new cheese syndrome, because patient has been smoking. So that could be one of the differential diagnosis. But then patient is 50 plus, so BPH can also be one of them as well, even when you have not considered, but cannot be the first one, cannot be the first diagnosis, cannot be the first one. Okay.
So